A prescription is a formal medical instruction given by a healthcare provider for the treatment. It specifies the medication, dosage, and frequency that the patient should follow. To make a prescription, click on the Actions button and select Prescription. In the subsequent window, you can prescribe either a drug in stock, a non-stock, a procedure, or a supplement. If it is a drug in stock, select the storage location at which you are prescribing from. Select the drug from the inscription item name list, as shown. You can change the billing scheme by clicking on the drop-down and picking from your selection. Input the quantity to be taken per time. The dosage unit will be indicated as per the item registration on the inventory. Enter the frequency per day. The duration of the medication. Select the period in according to the duration of the medication. The total quantity will be calculated according to the prescription, but you can edit the quantity. The dosage instruction will be input automatically, but you can edit. The prescription special instructions section provides additional details that the healthcare provider wants the patient to follow beyond the standard dosage instructions. Then, click on the Add button to save. To edit the prescription, follow the following steps. Right-click on the item and select. Edit the prescription as you wish and click on Update. On the prescription window, you can click on the View Non-Stock Report to view a non-stock prescription report. Click on the View Report to view the stock prescription report. As shown, close the window after adding the prescription. After saving the prescription, you can queue the patient to the cash office so that the patient can pay or be invoiced for the drugs.